Welcome to IRG's Health Talk. I'm Tom Hutler along with Shannon O'Kelly, physical therapist and president of IRG Physical and Hand Therapy. And our guest, Dr. Virtaj Singh, pain medicine specialist from Seattle Spine and Sports Medicine.
Dr. Singh, welcome. How you doing?
I'm doing well. How are you?
I'm doing great. Hey, tell us about your background, your training, physical medicine and rehab. You're a physician. What areas are you interested in practicing, and maybe what is your training?
So I did my residency in physical medicine and rehab at the University of Washington, and I also did a pain fellowship at the University of Washington as well. I see a lot of patients that have been in motor vehicle accidents, weekend warriors with various sports injuries, just anybody with some sort of musculoskeletal injury. I can try and help them.
And so your special area of specialty is really kind of musculoskeletal medicine, and that deals with cervical, thoracic, lumbar pain, and also sports medicine type injuries. And your chronic pain management, tell us about that, because that's an area where I think there's a huge need.
Yeah, certainly. I think the issue is many doctors understand acute pain, the pain that you have right after an injury. But for those people that don't heal within a few weeks or a few months and it becomes more chronic, that's a different animal. And a lot of doctors don't know how to treat that very well. So I try to fill that niche. And that's where having done a chronic pain fellowship is really helpful.
And what kind of options do you have for chronic pain patients? And maybe give us an example of some chronic pain scenarios.
Well, for example, after a whiplash injury, most people get better within 3 months, within 6 months. After that period of time, if you're still having pain, it can be very difficult to figure out what's going on. From my perspective, the first step is to really reevaluate the whole situation. Have there been diagnoses that have been missed? Has there been something that somebody else hasn't thought about? So a good, careful physical examination, review of the treatments up till that point, review of what x-rays, what imaging has been done. Are there other x-rays? Do we need to start thinking about MRIs that need to be done? Then I tend to look at what rehabilitation have they done to this point. Because just because they're still in pain at 6 months doesn't mean they've tried everything. And oftentimes patients will feel, oh, I've already done everything, they've already taken all the images, but there's oftentimes holes at that point.
Yeah, and you mentioned whiplash, and let's back up and talk about whiplash and kind of how you get diagnosed with whiplash and the mechanics of the injury, because you and I both know whiplash can happen at a 10-mile-an-hour car wreck or a hit or impact, and it can be a 60-mile-an-hour. I mean, it varies. It's a big animal. Tell us about whiplash.
Yeah, I mean, whiplash is sort of a generic term we talk about when people have been in a motor vehicle accident, although you can have a whiplash-type injury from sports injuries as well. The idea being all that force going through your neck and that sort of big flexion extension moment across your neck, all that force going through your neck can cause injuries in different areas. And you can get a variety of symptoms: headaches, neck pain, pain going down your arms, tingling down your arms, weakness into your hands. And yeah, you're right. You can have it at 10 miles per hour. You can have it at 80 miles per hour. I've seen people that have had very bad injuries with very low-speed motor vehicle accidents. And I've seen people hit at 100 miles per hour who walked away without a scratch. So it can go both ways.
Yeah, it's complicated. And one of the things that patients will often describe as they talk about their injury is, I didn't have pain right away. After the accident, I went to the emergency room, they took x-rays, and they looked at me and everything was fine. But 2 or 3 days later, I started experiencing symptoms. So whiplash can kind of come on immediately, but it also can be prolonged.
Certainly, and sometimes you don't appreciate some of the symptoms until even several weeks after. You could develop the numbness and tingling later on. You could injure the disc in your neck, and it causes some neck pain, and then a few weeks later, the disc starts to pinch on a nerve, and things start to get worse. So things can certainly get worse before they get better.
And diagnostically, you talked about x-rays and MRIs, and do you ever do what we call EMGs, or do you ever look at nerve studies in the case of whiplash?
Certainly. I do EMGs and nerve conduction studies. The idea being, if you have some weakness and we haven't figured out what's causing it or how bad it is, a nerve testing can sort of help with that. It can tell us, gee, did you develop traumatic carpal tunnel after the accident? Do you have thoracic outlet syndrome after the accident? Do you have a pinched nerve in your neck? And nerve testing I usually don't do immediately. I usually wait at least 6 weeks after the injury. But if you're having weakness and numbness and it's persisting for quite some time, it's worth considering.
Well, I have a lot of appreciation for what you do, being a physical therapist and you being a physical medicine physician. I mean, you're almost like a detective. I mean, because you're a lot of times dealing with patients that have been in pain for a little while, and patients that are in pain are frustrated. And we all know that we all want a quick and easy answer. And sometimes you have to really dig deep. You mentioned thoracic outlet syndrome. You mentioned cervical dysfunction, disc. How do you tell the difference from these signs and symptoms? Because they could be multiple symptoms and multiple things going on.
I think the most important thing, and something we try to do in our clinic, is really spend time with the patients. My first patient eval is always an hour. I just don't think you can get the whole story and really do a thorough examination and really think through all the possibilities in less than that. And the other thing is to sort of think outside the box. Yeah, you have the common things that cause pain, but when somebody hasn't gotten better after several months, sometimes you have to think, gee, what else could it be? For instance, when somebody has numbness and tingling in the hands, most people think, oh, it's either carpal tunnel or a pinched nerve in the neck. Sometimes you have to think about thoracic outlet syndrome or other potential sources for this. So just really listening carefully to the patient, thinking through, and doing a careful, good physical examination is the first thing that needs to be done.
In your experience, whiplash, I mean, should it resolve in 6 to 8 weeks, or is there a certain time period where if it doesn't go away, there needs to be further diagnostic workup or follow-up, etc.?
There's this myth out there that if you're in a whiplash injury, it should magically resolve within 3 months. And for some people, it does. For about more than half, maybe 55% of patients, you'll get better within those first 3 months. But the problem is, what about the patients that don't? And you know, if you're in a whiplash injury and you're having bad weakness, new weakness, you need to be seen sooner than later. If you're having neck pain and headaches and some muscle tightness and it gets better within a week or two, you don't necessarily need to come in immediately. But there's a subset of patients that have not gotten better in 3 to 6 months. That's sort of my bread and butter, where I take a fresh set of eyes and look and try and see if there's injuries that we can intervene on at that point.
And one of the things you mentioned I want you to talk about a little bit is TOS, or what we call thoracic outlet syndrome. It's an area in the whiplash category that sometimes can be really complicated, and you have an interest in that area.
Yeah, the issue with thoracic outlet is most people, when they have had a neck injury and they have numbness and tingling to their hands, the presumption is that you've herniated a disc in your neck and you're pinching a nerve. And then what happens is you end up getting the MRI and it's normal. And then people say, well, we don't know why you have the numbness and tingling in your hand. The problem is you could have something called thoracic outlet syndrome. And it's the area on the sort of front part of your neck and across your chest. All your nerves, the nerves that come out of your neck, have to go through this really tight space. And when you've had a whiplash type injury, part of the problem is when those muscles go into spasm, they close off that space and you can get numbness and tingling into your hands. And oftentimes people will tell me, gee, when I raise my hands above my head, my hands go numb, or they feel cold, or they feel heavy. But somebody got an MRI of my neck and there's nothing pinched. Well, oftentimes it's thoracic outlet syndrome. And it's one of those diagnoses that people don't think about. Some people think, oh, well, the only time you have thoracic outlet syndrome is if you have an extra rib, which is maybe 1% of the cases where somebody has an extra rib. But I do see a lot of it after motor vehicle accidents, where those muscles get strained, they get tight, and they end up pinching those nerves.
And a classic sign of that, would people experience numbness and tingling with activity, at rest, at night? Is there any kind of indication that you find that you need to look at to rule out thoracic outlet syndrome?
Usually they'll tell me they feel a sense of tightness across the front part of their neck and chest, and that when they lift their hands over their head, their hands go numb. I'll hear people tell me when they wash their hair, their hands are going numb, or when they're talking on the telephone, their hands go numb. But some people just have a lot of numbness and tingling at rest. It may just get worse with their hands over their head.
Yeah, this topic that we're talking about, just for our listeners out there, this is normally probably a 2-week class in school, or it's a 4-day seminar, because it's a huge topic, whiplash, very complicated. The length of time that it can last it varies. So how would someone get a hold of you if they felt like they needed a workup? Because I mean, I agree with you as a physical medicine physician. You guys and gals are known for digging deep and taking a lot of time to kind of, like I said, be musculoskeletal detectives. How would someone get a hold of you if you had a question?
They could probably go through our website at seattlespine.com there's a link there where I believe those emails go directly to me.
Great information. I will have to have you back. Thank you.
If you'd like more information on this topic, as well as how to contact Dr. Virtaj Singh, go to irgpt.com and click on the Health Experts tab.